Let's talk to somebody who probably is a little more right-minded than the folks that the GOP leadership is listening to on all of this. Dr. James Pickney. He is a board-certified family medicine physician. Dr. James studied general surgery at the prestigious Cedars-Sinai Medical Center in L.A. after graduating from Baylor College of Medicine in Houston. He's the founder and CEO of something called Diamond Physicians, folks, a concierge medical practice focused on the patient-physician relationship, which also seems lost in this whole discussion. Diamond bypasses the cumbersome and inefficient middlemen in the traitorous insurance companies and the like. Dr. James, great to talk with you once again.
Hey, Chris, good morning.
The GOP in the Senate has failed on their Obamacare tweak. We can't call it a repeal because they don't repeal anything. They're tweaking Obamacare. What would you suggest where would you suggest that they would start if they wanted to have some success?
Well, first we have to address what's going to happen to the 22 million people that under the current bill will lose their insurance. And I think that's the biggest hurdle. We keep focusing on the insurance premiums, but the marketplace has already been disrupted. We're not going to go back to 2008. So we have to focus on the future and how do we reinvigorate that patient-physician relationship and how do we guarantee access to physicians? We have a huge shortage. Medicaid and Medicare populations are going to lose coverage and access to their doctor. So what do we do in the meanwhile? Until they come up with a replacement plan and a bona fide, legitimate angle on how to increase access to care, we're not going to go anywhere.
Yeah, and of those 22,000, millions of those folks who can afford insurance will stop buying it because they'll have a choice once again, because right now the government under threat forces our citizens to buy insurance. So you mentioned Medicaid access being lost. It's because the previous administration dumped a whole bunch of ineligible people onto the Medicaid rolls, right? Because it was set up to help vulnerable children and vulnerable women and disabled folks, but the last administration says we're going to dump a whole bunch of able-bodied leeches onto Medicaid, and that's why so many people who really need it can't get access anymore because doctors are overwhelmed, right?
And I've seen that firsthand in the ERs. Unfortunately, people abusing the Medicaid system is very commonplace. We see dozens of cases every day in every single ER in the country because people use the ER as their primary care physician. So if you don't have insurance, you can go into the ER. Or you can apply for Medicaid in certain situations and you're covered. Also, non-citizens of the U.S. can also go in there and receive care. And unfortunately, we don't have the resources to take care of everybody. So we have to use our resources wisely for the people that really need Medicaid and deserve it. So also, education is a huge issue. I'll see children on Medicaid, and because their parent couldn't get in to see the doctor, they come to the ER. So now you're spending $3,000 or $4,000 on a case that should have cost the system $50. And again, that happens over and over again every day.
And Obamacare was supposed to fix all of that. Dr. James Pickney is our guest right now, folks, of Diamond Physicians, Concierge Medicine. Isn't the cause of Obamacare's failure, or one of the causes of Obamacare's failure, and the foreseeable failure of any GOP effort as it stands right now, is all of these money interests who are writing these bills, the traitorous insurance companies, the big hospital groups, big pharma, and the like? Aren't they the culprits here, that they want to get paid and the American people are suffering because of it?
Yeah, unfortunately, a lot of the big lobby groups that are focusing on these bills are affecting the bills that's detrimental for the American people. We need to go back to the free market system that drives competition, lowers healthcare premiums, and actually improves and injects innovation into the healthcare marketplace. And right now, all the laws are set up for hospitals to gain, for insurance companies to gain, and we really need to look back, okay, what can we do to allow Americans to access healthcare and help physicians provide quality care? And we have some great ideas at Diamond Physicians, Chris. We are doing some revolutionary things even since the last time that we spoke. Now we have 3 locations, opening another one in Atlanta, trying to go nationwide. The direct primary care movement is gaining huge momentum. Doctors are getting it. They're getting off this insurance wheel and going to cash pay, a capitated rate, one low monthly fee for unlimited visits, no copay, 24-hour access to your doctor, and unlimited urgent care. And now we're actually instituting something called Dr. Link, which is a revolutionary telehealth platform that actually provides the same doctor every time you call in. We're not a 1-800 number with a queue. It's the same provider, and we're doing that for somewhere in between $30 and $40 per month, unlimited consultation. So we think that some of these new revolutionary, innovative, free market healthcare solutions are going to be the future of healthcare and really help solve this problem.
Yeah, you took me right where I wanted to go, because there is an effort there. The previous administration demonized and blamed the greed of people like you, the greed of doctors for all of the exorbitant costs in healthcare, and you and I know how much of a sham that is. But let me ask you, because I was surprised and shocked to find this out the other day, because a physician actually called up the program and said, hey, if I wanted to get together with a whole bunch of other doctors and go start my own hospital that we could run tons better, then I am prevented doing that because our elected leaders sold us out to those muddied interests. There is a law that prevents me from doing that. Can you detail what that law is, Dr. James?
Yeah, that's true. I believe it was passed around 2010, where physicians cannot own hospitals. It's illegal, especially here in Texas. I know for a fact it is illegal. We cannot band together and lower costs. I have great aspirations to have a cash pay hospital that charges fair market value for services, 10 cents for an aspirin instead of $80. But unfortunately, until some of the legislation changes, that is impossible.
Yeah, no, and I took a call on a later version of the Salcedo show yesterday who said guy was scheduled to go for an MRI. His copay was $3,000. He said, I want to do it for cash, and it was $400. And he got it done for $400 cash out of pocket instead of his quote unquote copay. Last thing. Isn't fee for service your model? Isn't that the wave of the future? And shouldn't this be where the American people, forget Congress, forget our so-called leaders who have sold out to the moneyed interest I mentioned? Shouldn't we bypass Congress as a people? Shouldn't we bypass all of these conglomerates and start looking toward concierge medicine, getting back that relationship between doctor and patient?
Yeah, the American people can absolutely choose. We have products like Diamond Physicians, Direct Primary Care, and Dr. Link. I like to refer to it as membership medicine. So instead of the fee-for-service where you have to perform a procedure and bill a CPT code to an insurance company, capitated rate, all included, one low monthly fee, and actually have direct access to your doctor, whether it be via telemedicine platform or in person. That's the future of healthcare. It's going to solve all of our problems, and the American people actually can make this happen by choosing to find a direct primary care provider in your area, or going to thedrlink.com and signing up for one of our telehealth physicians that will see you anytime, any day, 24 hours a day, same doctor.
Dr. James Pickney, everybody, Diamond Physicians, on the forefront of trying to revolutionize medical care and bypassing moneyed interests and Congress to do it. Thank you, sir. Appreciate the time and expertise on the Chris Salcedo Show as always.
Oh, thank you, sir. Appreciate you.